Okay, let's unpack this. Imagine this scenario. In just the next 5 minutes, maybe 12 seniors will have a heart attack.
Yeah.
And here's the statistic that, well, it really hits hard. Nearly half of them will face it completely alone.
That figure, from the material we've looked at for this deep dive, it's incredibly stark, isn't it?
It really is.
And we also saw that, a big majority, like 65% of heart attack deaths in people over 60, that happen before they even get to a hospital.
Wow.
It just hammers home how critical those first few minutes really are.
Absolutely. And that's exactly what we're getting into today. You share this pile of sources, and they offer some really powerful insights, specifically about how seniors can, well, dramatically boost their chances of survival if they're alone during an attack. Our goal here, to kind of cut through it all and pull out the absolute must-know actionable steps. What do you have to know? What surprises did we find in there?
It's such a vital topic because, as the research points out, a heart attack after 60, it often looks different. The symptoms aren't always, the obvious dramatic chest-clutching thing we might imagine. Your body, it just responds uniquely as you age.
And the protocol changes too, right? If you're alone versus having someone there.
Exactly. The plan of action is different.
The sources were pretty compelling, saying that just knowing and following specific steps can genuinely change the outcome. They had examples, didn't they? Like that man, Richard.
Yeah, Richard's story was powerful. Survived a major attack when he was alone. But it's crucial, and the material is really clear on this. These steps are about surviving until help gets there.
Okay.
They don't replace professional medical care. Not at all.
Think of them as bridging that really dangerous gap then.
Exactly. Simple knowledge, used quickly, it can buy you precious time.
Which means the very first hurdle is just, well, recognizing what's happening.
Precisely. Tip number 1, right from the top of our list from this material. Know the unique warning signs in seniors. The documents we looked at really stress this. The big problem is that so many seniors miss or, just brush off symptoms because they aren't that classic chest pain.
I was surprised by that number. Nearly 40% of seniors in those studies don't get that specific pain.
It's a huge percentage. And the key insight here is that what doctors might call atypical symptoms, well, they're actually pretty typical for older adults having a heart attack.
Okay. So if it's not always that crushing chest pain, what does it look like? What were those 7 signs you saw listed again?
Right. They paint a different picture. First, there's unusual fatigue or weakness, and not just feeling a bit tired, but like a sudden, really profound exhaustion that comes out of nowhere.
Okay.
Second, shortness of breath. Even when you're not doing much, maybe even just sitting down, if suddenly walking a few steps leaves you gasping, that's a big red flag.
Right.
Third, unexpected sweating, often cold and clammy, and it's not because it's hot or you've been exercising.
Got it. Not your usual, post-gardening sweat.
Exactly. Fourth, nausea, indigestion, or discomfort high up in the abdomen. This one's tricky because it's so easily mistaken for, like, a stomach bug or just heartburn. Fifth, feeling lightheaded, dizzy, or experiencing sudden confusion. Now, this last one, confusion, really stood out to me. The sources said it could be the only initial sign in some older people.
That's fascinating. And honestly, a bit scary. I wouldn't automatically connect confusion with a heart attack.
Critical point from the reading, yeah. Sixth, unexplained pain or discomfort in places other than the chest, think jaw, neck, back, or maybe either arm.
Not just the left arm stereotype then.
Not necessarily, no. And seventh, sleep disturbances or maybe increasing fatigue in the days or even the week leading up to it. The research suggests many seniors actually have subtle warnings beforehand.
And the material highlighted this is especially true for a specific group.
Yes, women over 60, they're particularly prone to these less obvious signs, the fatigue, the shortness of breath, the nausea. The story of Joyce, she was 83, it really shows this. Her symptoms were just fatigue, dizziness, and sort of a general feeling of being off. No chest pain at all. It was actually her neighbor who realized something serious was wrong.
Wow. So the takeaway from this first tip is really powerful then.
Yeah.
Trust your gut. If something feels genuinely off, especially if you've got a couple of these signs together, don't wait.
Exactly. Don't delay.
Because once you suspect it, the very next step is, well, it could literally be life or death.
Which brings us straight to tip number 2. Call 911. Immediately, do not drive yourself. Now, this might sound obvious, but the information provided gives really compelling reasons why driving yourself is just such a dangerous move.
Why is getting 911 on the line so urgent? What's the core reason?
Because time is heart muscle. Simple as that. The material stated that for every minute treatment is delayed, more heart muscle tissue dies.
Okay.
Irreversible damage can start in as little as 10 minutes, and significant permanent damage after just 30 minutes. That window is incredibly small.
30 minutes. Wow.
Yeah.
And the sources gave, what, 3 clear reasons not to drive?
They did. First, driving takes focus and energy, right? That puts extra strain on a heart that's already struggling.
Makes sense.
Second, if your condition suddenly gets worse while you're driving, you become a serious danger on the road to yourself and to others.
Yeah.
And third, and this is really key, ambulances are basically mobile emergency rooms. Paramedics can start critical care right there, giving oxygen, maybe medications, even CPR, or using a defibrillator if needed.
And they call ahead too, right?
Exactly. They alert the hospital, so a team is ready and waiting for you. Driving yourself just bypasses all that immediate vital support.
That story about Anthony, the 76-year-old who drove himself, passed out and crashed. That really drives the point home, doesn't it?
It's a sobering example for sure. So the material lays out exactly what to do if you're alone after calling 911. First, stop whatever you're doing. Find a comfortable spot to sit or lie down. When you talk to the dispatcher, be clear. Say you're a senior, you think it might be a heart attack. That helps them prioritize.
Good tip.
And critically, unlock your front door immediately. So first responders can get in easily if you become unable to open it.
Right.
And if you have a medical alert device, use that too, in addition to calling 911.
So the absolute priority is getting professional help on the way first, even before calling family or friends, which might be the first instinct for many.
Absolutely. Calling for help isn't giving up. It's the single most decisive, smartest thing you can possibly do in that situation.
And after that call, there's something else the sources really recommend doing right away, isn't there?
That takes us to tip number 3. Take aspirin correctly. And the correctly part is, well, it's vital. Aspirin is common, but using it the right way during a suspected heart attack can be a huge help. Its job is basically to help stop existing blood clots from getting bigger.
I saw the statistic taking it correctly could cut mortality by up to 23%. That's significant.
It really is. But there's a very common mistake people make with it.
What's that?
Well, the story of Sylvia highlighted it. She just swallowed a regular aspirin whole with some water, thinking that was it, the problem. Swallowed whole, it takes much longer to actually get into your system and start working.
So speed is key here.
Yeah.
How do you maximize its effect quickly?
Right. The sources give exact instructions. After you've called 911, take 325 milligrams of aspirin. That's usually 1 standard adult aspirin or 4 baby aspirins.
Okay.
And here's the crucial step. Chew it thoroughly before you swallow.
Chew it.
Yes, chew it well. That allows it to start absorbing through the tissues in your mouth and stomach much, much faster. It can reach your bloodstream in about 5 minutes that way, compared to maybe 30 minutes or more if you just swallow it whole.
5 minutes versus 30. Big difference.
Huge difference. Use just a tiny sip of water if you need it to help swallow the chewed bits. And always remember to tell the 911 dispatcher and the paramedics that you took aspirin, how much, and roughly what time you took it.
Good point. Are there times someone should not take aspirin, though?
Yes, absolutely. Important cautions. Don't take it if you know you're allergic to aspirin, if you have a history of bleeding disorders, if you're already taking blood thinning medication, or, of course, if your doctor has specifically told you not to.
Okay.
And also, make sure it's aspirin, not other pain relievers like Tylenol or Advil or ibuprofen. They don't have that specific anti-clotting effect you need right then.
So keeping some non-coated chewable aspirin handy, maybe in a couple places like the kitchen and the bedside table, as the material suggested, that seems like a really smart preparation step.
It absolutely is. Think of aspirin as a critical first aid tool while you wait for the professionals. It's not a cure, but taken correctly, it can genuinely make a significant difference.
Okay, moving on to tip number 4. This one surprised me a bit because it kind of goes against what you might think to do, or maybe what you see in movies sometimes.
Tip number 4. Position yourself for survival sitting versus lying down.
Yeah, the material really emphasized that while lying flat is often shown as the go-to in emergencies, for seniors having a heart attack, it's frequently not the best thing to do.
Why? Why does body position matter so much in this specific case?
It directly affects how hard your heart has to work and how well oxygen gets around your body. And that's especially critical for an older adult whose system might already be under strain.
Right.
The story of Carlos, he was 77, it demonstrated this. He lay flat because he'd seen it somewhere and thought that was right, but it actually made his breathing much worse.
So what positions are recommended then? Does it depend on the specific symptoms you're feeling?
Yes, exactly. The positioning should be tailored to what you're experiencing most acutely. If shortness of breath is the big issue, the advice is to sit upright as much as possible. Maybe propped up high with pillows, sometimes called the high Fowler's position.
Okay, sitting up. This lets your lungs expand more easily. It reduces the workload on the heart and improves oxygen intake. Now, if you're feeling really lightheaded or dizzy, a slightly reclined position, maybe around 45 degrees with good support, is probably better.
Why reclined?
It helps maintain blood flow to the brain without putting too much pressure back on the heart. And if nausea is a major problem, sitting upright is still generally good, but maybe leans slightly to your left side. That can help prevent aspiration if you were to vomit.
The main thing being, don't stay standing or try to walk around. Get stable.
Exactly. Get stable quickly. Also, loosen any tight clothing, think collar, belt, waistband, anything restricting.
Good idea.
And if you feel cold and clammy, which is common, try to cover yourself with a blanket. Shivering actually makes your heart work harder, so staying warm helps.
And where should you be? Does location matter?
Ideally, if you can manage it, get to a comfortable spot near the unlocked front door. But, if the symptoms hit you hard upstairs, don't try to make it down. Just stay put and tell the 911 operator exactly where you are in the house.
Again, these are temporary measures while waiting. But they're about optimizing things, right? Making it easier for your body.
Precisely. They can genuinely help manage symptoms and, ease the burden until professional help arrives.
Okay, tip number 5, tackles something that must feel incredibly hard to manage when you're terrified and in pain. Your breathing.
Tip number 5, control your breathing using the 4-7-8 technique. Yeah, during a heart attack, panic and adrenaline are just natural reactions, but they actually make things worse by making your heart work even harder and ramping up anxiety.
Which is the last thing you need. So
Well,
the source has suggested a specific technique to actively fight that.
exactly. The 4-7-8 breathing technique. It sounds simple, but it can be really powerful for calming anxiety and, in turn, maybe easing some strain on the heart.
Was there an example for this one too?
There was. Vivian, 71 years old, she said focusing on the steps of this breathing technique not only helped keep her calmer, but it gave her something constructive, something she could do during a time that felt completely overwhelming.
That makes sense.
Yeah.
How exactly do you do it? Can you walk us through it?
Sure. First, find a comfortable seated position if you can. Then, place the tip of your tongue just behind your upper front teeth and keep it there throughout.
Okay, tongue position. Got it.
Now, exhale completely through your mouth. Make a gentle whoosh sound as you do. Then close your mouth and inhale quietly through your nose while you mentally count to 4.
Inhale for 4.
Then hold your breath for a count of 7. The sources did note if holding for 7 is really difficult because you're very short of breath, you can shorten it slightly, but aim for 7 if possible.
Hold for 7.
Finally, exhale completely through your mouth again, making that whoosh sound for a count of 8.
Exhale for 8. So 4, 7, 8.
That's the cycle. Inhale 4, hold 7, exhale 8. And you just repeat this cycle several times.
And how does that specific pattern help physically? What's the mechanism?
Well, that long exhale, the 8 count especially, is key. It helps activate your parasympathetic nervous system. That's your body's rest and digest system. And it actively counteracts the fight or flight panic response.
Yeah.
For seniors, the analysis showed this can help lower heart rate and blood pressure a little bit and also make your oxygen use more efficient. The studies mentioned even suggested it can help reduce how much pain you perceive and significantly lower anxiety during the event.
And it gives you a sense of control, I imagine.
Exactly. In a situation where everything feels chaotic, having this one thing you can control can be incredibly grounding.
Yeah, I can see that. Now, tip number 6. This one feels different. It takes us into more extreme last resort territory.
It does. Tip number 6, self-administered chest compressions if necessary. Now, the documents were very clear. This is something to consider only in the most dire situation. If you're alone and you genuinely feel you are about to lose consciousness, it's very different from traditional CPR.
And the material acknowledged this as controversial, right? Not universally recommended.
It did. It acknowledged the controversy, pointing out that not all medical professionals advocate teaching this. But the author felt strongly that seniors who are alone should at least be aware of this possibility in that truly life or death moment.
Was there an example for this too?
Yes, Samuel's story. He was 74, felt himself blacking out, and attempted this technique. He believed it potentially gave him that fighting chance, just enough time until the paramedics arrived.
So how is this modified technique actually described? What do you do?
If you feel consciousness slipping, the instruction is to immediately try to get onto a hard surface, like the floor. Make a fist with one hand, place the knuckle side firmly in the center of your chest, right on your breastbone.
Okay, fist on the sternum.
Then use your other hand to push down forcefully on that fist. You're aiming to compress your chest about 2 inches deep, then release completely. The rhythm is crucial. Try for about 100 compressions per minute. The sources mention the beat of the song Stayin' Alive as a guide.
Right, the classic CPR rhythm.
Exactly. And the idea is to keep attempting this until help arrives or, hopefully, you regain some consciousness.
And the rationale behind this, however cautious, what's it supposed to achieve?
The cautious thinking is that it might generate some very limited blood circulation to the brain and heart, especially if the heart has gone into a dangerous rhythm like ventricular fibrillation. It could potentially delay irreversible damage for just a few moments.
But it's not as effective as proper CPR.
Not even close. And the sources were very upfront about the risks, like potential rib injury, especially if someone has osteoporosis or similar conditions. That's why they stressed it's an absolute last resort. You prioritize 9/11, aspirin, positioning, breathing. This is only if you feel you're right on the edge of passing out.
Definitely knowledge for the most extreme situation, but maybe empowering just to know that option might exist if everything else fails.
Absolutely. It's about having every possible, even if limited, tool in the toolbox when you're completely on your own.
Okay. And that brings us to the final tip, tip number 7, which the material actually described as maybe the most important one of all.
Tip number 7, prepare in advance. Create a heart attack action plan. Yes, the analysis we read made a very strong case that this is really foundational. The logic is straightforward. During a heart attack, your ability to think clearly is just hammered by pain, fear, maybe reduced blood flow to the brain.
Right.
Having a plan worked out beforehand takes away the need to make complex decisions when you're in crisis mode.
This feels like taking control before anything happens. The story of Louise, 79 years old, really illustrated that. She just followed her plan, step by step, didn't have to think, and it saved her life.
Her story is incredibly powerful. So what goes into this plan? The sources detailed several components. First, create a simple emergency medical information card.
What should be on that?
Your name, age, key medical conditions, any medications you take regularly, allergies, emergency contact numbers, and your doctor's name and number. Keep copies in your wallet or purse and maybe visibly somewhere at home, like taped to the fridge door. Smart. What else?
Strategically place aspirin, that chewable kind we talked about, in easy-to-reach spots, maybe the kitchen, bathroom, bedside table. Program ICE in case of emergency contacts into your phone. Set up the medical ID feature on your smartphone if it has one. Paramedics are trained to look for that.
And what about those medical alert devices?
Also, strongly recommended. Whether it's a pendant you wear, a smartwatch with fall detection and emergency calling, or another system. Anything that makes calling for help easier and faster.
Makes sense.
Also, a simple but important one, make sure your house number is clearly visible from the street, ideally with reflective numbers. Helps emergency services find you quickly, especially at night.
Good point. And the key part that the sources stressed, more than just having the stuff.
Practice the plan. Actually mentally walk through the steps. Where would you go to sit? Where's the aspirin? How do you unlock the door quickly? Just building that simple muscle memory can be invaluable when your brain isn't working at 100%.
And importantly, talk to your family or maybe neighbors about your plan, especially if you live alone. Maybe arrange for regular check-ins.
Good idea.
The material also advised reviewing and updating the plan regularly, say every 6 months, or anytime your health or medications change. Oh, and they also mentioned discussing nitroglycerin with your doctor, if that's something relevant to your specific heart health.
So this isn't about living in fear, is it? It's about proactive empowerment.
Exactly. It's about significantly increasing your chances of a good outcome by being prepared. It's not dwelling on the worst, it's giving yourself the best possible chance.
So let's bring it all back around. Let's revisit Richard's story, the gardener we mentioned at the start. Now we can see how he actually put these steps into practice.
Right. Richard, 72 years old. He didn't get chest pain. What he felt was that unusual fatigue and that pressure in his back. But because he'd learned about the unique senior symptoms, he recognized, hang on, this isn't just tiredness from gardening.
He recognized the warning signs.
He did.
Yeah.
So he immediately stopped what he was doing, called 911 right away. He chewed an aspirin he kept handy in his shed, actually.
Wow, prepared.
He positioned himself sitting upright to help his breathing. He used that 4-7-8 technique to try and manage the anxiety he was feeling. And critically, he had unlocked his front gate earlier that morning, just as part of his regular preparedness routine.
And the outcome. Because he did all those things.
Paramedics got to him quickly, and even though it turned out he had a 95% blockage in a major artery, the one they sometimes call the widowmaker, his fast recognition and all those preparatory actions meant he suffered minimal heart damage.
That's
He
incredible.
was back tending his garden just a few months later.
His own words in the source material were really striking, weren't they?
They were. He said something like, "The symptoms were nothing like I expected. If we hadn't had that conversation about what to look for and what to do, I probably would have just sat down to rest thinking I was tired. By the time I realized what was happening, it might have been too late."
Wow. Stories like Richard's, they just underscore how much impact these seemingly simple steps can actually have. They completely changed his outcome.
Absolutely.
Okay, so to quickly recap everything we've distilled from the source material in this deep dive. First, recognize those unique, often subtle warning signs in seniors. Don't just wait for chest pain. Second, immediately call 911. Do not try to drive yourself.
Crucial.
Third, take aspirin correctly. That means chewing 325 milligram unless there's a reason not to.
Chew it, yes.
Fourth, position yourself smartly based on your symptoms. Often sitting up is better than lying flat.
Right.
Fifth, control anxiety and heart strain with that 4-7-8 breathing technique. It give you something to focus on.
Yeah, manage the panic.
Sixth, know about that modified self-compression technique, but only as an absolute last resort if you're alone and feel you're losing consciousness.
Last resort only.
And maybe most powerfully, seventh, create and practice a heart attack action plan before you ever need it. Preparation is key.
That's the foundation. The core message resonating from all these documents is really clear. Knowledge, combined with proactive preparation, is your most potent defense against heart disease, especially in those critical moments when you might find yourself alone.
Thinking about everything we've just covered, what stands out most to you, the listener? What felt most surprising, maybe? What's one concrete step that feels most actionable for you? Maybe something you could do today or this week?
The sources left us with a thought that really stuck with me. It was something like, in a situation where literally every second counts, being prepared isn't just, a smart idea. It's maybe the most profound gift of life you can give yourself. It really changes how you think about vulnerability and about preparedness, not just for yourself, but maybe also for the older people you care about in your life.
A powerful thought to end on. Thank you for joining us for this deep dive.